Today we're going to be hearing from Dr. Dana Vanlandingham. She's a professor in the College of Veterinary Medicine, and her project is low-cost feed and low-level exposure to mycotoxins may have high-cost consequences. Dr. Vanlandingham.
Okay, thank you for inviting me to talk about our project. As you said, I'm going to be talking about immune responses to low-level aflatoxin exposure in swine feed. And our catchier title is low-cost feed and low levels of exposure to mycotoxins may have a high-cost consequence. And I'll just briefly introduce myself. I'm a professor over at the vet school in the Department of Diagnostic Medicine and Pathobiology in the College of Vet Med. And I'm going to first go over kind of what I'm going to talk about. So initially, I'm going to introduce the other PI and give you a little bit more background about myself, then briefly go over agriculture in the US and how aflatoxins play a role in agriculture and the relationship between pigs and aflatoxins, the hypothesis for the study and our objectives, and then go over experiment 1 and 2 and summarize with the benefits of the collaboration with the multidiscipline group that we had here on campus, and summary and future direction. So this is Dr. John Leslie. He's a distinguished professor here at K-State, and he's a fungal geneticist. And he initially approached us because of his interest in mycotoxins. And he wanted to see if these mycotoxins are causing problems with the immune system in pigs. And so that's how we kind of got started on this project. So he's currently out of the state. He's at DC working at the Department of State Office in Global Food Security. He's over there for a year. Another thing that he does that's kind of interesting is he leads the Australian K-State Oz to Oz program. And he also has been running a workshop on fusarium since 2000. And he runs that here at Kansas in the summer. And he also has run it in 6 other countries. And there's been about 700 people that he has be able to have attending this conference, and they're from about 70 different countries. And then this is me. This is former President Myers visiting the BRI, which is where I am housed. It's the Biosecurity Research Institute. So I'm a professor at the vet school, but I'm over here at the BRI, and I work on viruses transmitted by mosquitoes. So I'm a vector biologist, a molecular arbovirologist. And I'm interested in vaccines and diagnostics, and I also work on basic science, just looking at virus vector host environment interactions. And I have also a very big interest in training younger people, normally younger people, in how to work safely in a high containment environment. So I am the director of several training programs that are mostly sponsored by the USDA. I have 3 different training programs with USDA, and I have a previous fellowship for transboundary animal disease training with the Department of Homeland Security. So you can see between the 2 of us, we have very diverse backgrounds, which is one of the things that you guys are interested in. So this was interesting that we found something that we could both work on. Next, I'm going to just go over why agriculture is important. I'm sure you all know, but this is just some numbers I got off USDA. Basically, we have quite a lot of the GDP is associated with agriculture. It's 12% of our GDP, and it's also a huge amount of our employment for the US. It's 17% of our employment, so 1 in 6 jobs has something to do with agriculture. And we have a lot of plants that we are growing, and the one that we're interested in is more the livestock. So there's the cows and the calves and the hogs and chickens and turkeys that are making up a lot of the livestock in the US. And it's a huge industry. It's $183 billion. And there's awful lot of cows, 95 million cows and calves, and they're primarily in Texas, Kansas, Nebraska, California, Oklahoma. We have beef cows and the dairy cows that are making up 19% and 9% of US agriculture, respectively. Then we have the 60 million hogs, which is what this project was concerned with, and that makes up 25% of the US agriculture. And it's in these primarily these 5 states that are listed here. I'll get into more detail in a second. And then we have a lot of chickens and a lot of eggs and a lot of turkeys that you can see here. So 11% of the US agriculture's in the poultry. This just gives an idea of how pork, beef, and broilers kind of compare to each other in billions of pounds. So beef and pork are very, very comparable on how many pounds they are making in the US. And this is 2012 data from the USDA. The swine industry, we have about 65 million hogs. They're produced in every state, but about 74% of the swine are in just 10 states. And 50% of the swine are from about 110 operations. And so these operations are really big, about 250,000 hogs each. Kansas has over 3.7 million pigs with a gross market value of almost $500 million. So Kansas pork, we're the 10th in the nation, 2.8% of the national production. There's 3 million, almost 400, or 3.4 million pigs sold in 2015 with a market value of almost 500,000, like I said. And pigs eat a lot of the grain sorghum and the corn, which is where this project comes in. And just FYI, we have a lot of the jobs are related to the pork industry. We have 4,500 jobs with a total economic contribution of $716 million. So what we were looking at was how this aflatoxin is affecting pigs' growth and health, basically. So an aflatoxin is a mycotoxin, and it's produced by Aspergillus flavus. And it's a really common contaminant that's found in animal food and people food. And it's present at some levels in most commercial feeds. There's 4 different aflatoxin isomers, the aflatoxin B1, B2, the aflatoxin G1, and G2. So the one that we're looking at was the aflatoxin B1. So we wanted to look at B1 because it's the one that's most commonly found in food, and it is known to be an inducer of hepatocellular carcinoma in humans, and it is also known to cause growth reduction and immune suppression in animals. So because of this, the USDA has put a limit on how much aflatoxins you can have in the food, and they've put the limit at 20 parts per billion, and that's for both pigs and people. So the cost to the finished pig by mycotoxins is estimated to be somewhere in the $7 to $18 per animal. So this is how much they're losing of weight gain. They're not gaining the weight. But the mycotoxins haven't been studied at the level that we decided we wanted to look at. They've normally been focused on really high or very high levels that are really detrimental to the animals and sometimes are resulting in death. So the most chronic exposure to these mycotoxins, they don't really result in a lot of symptoms or a lot of death. And the USDA has basically decided that the 20 parts per billion is appropriate. The young swine are actually more susceptible to the aflatoxins, so the USDA has set the limit at 5 parts per billion, and just should be noted that the milk of mothers can actually spread the aflatoxin to the baby, so the 5 parts per billion has to be also in limit on the milk. So there's been a lot of data that has shown that this aflatoxin can cause human immune dysfunction. And the dysfunction is particularly important in a lot of the underdeveloped countries where the contaminant of mycotoxin in the grain supply is more common than it is here in the United States. And this also kind of coincides with higher HIV and hepatitis B titers, and normally that's associated with having some sort of compromised immune system. So there is thought that aflatoxins are compromising the immune system, and that's why people are basically less healthy for some of these diseases. So we wanted to look if aflatoxin adversely affects growth rate or weight gain, or both, and whether or not the recommendation that it's at the 20 parts per million is appropriate or should be even lower. So basically, if chronic exposure to aflatoxin was found to adversely affect the immune system function, this could provide important information related to immunization of swine to protect them against swine diseases. So our second aim was to look at how the aflatoxin could affect the immune system, which would then again affect immunization. So our hypothesis was chronic exposure to subacute levels of aflatoxin in feed reduces the overall health, including weakened immune response, vaccine efficacy, and lowers the animal's growth rate. In other words, low levels of aflatoxin may actually still be inhibiting some sort of immune response, and it could affect how the vaccines are working. So our objectives were, we had two aims. The first one was to just find out if there's any kind of immunological or growth rate changes in swine associated with low levels of aflatoxin. So we had two parts of this. First, we wanted to assess the impact of subacute aflatoxin in feed to pigs by looking at the immune response following exposure to aflatoxin in the feed. And we wanted to use levels below the USDA requirement of 20 parts per billion. And then we wanted to test this using the ovalbumin, OVA antigen injections to stimulate antibody production. Then our other sub-aim was to assess the general health of the pigs exposed to aflatoxin in the feed by monitoring weight gain, temperature, and just compare it to animals that had no aflatoxin in their feed. The second aim was to determine the effects of subacute aflatoxin exposure on swine influenza virus vaccine efficacy. So the first aim, again, we're determining the immunological, pathological growth rate changes in the swine. And how we're doing this is just looking at immunological changes using the ovalbumin. The pathological changes, we've just looked at general health and their temperature. And growth rate changes, we're obviously using weight. So it's been shown that the mycotoxins can have effect on animals, decreased growth rate, decreased weight gain, reduced immune system activity accompanied by increased disease susceptibility and lowered vaccine efficacy, which is our second aim. So the overall goal was just to determine if there's unidentified production losses from these exposures at these lower limits that are less than what is normally found. So this is kind of exactly how we set up the first aim, and then I've got a picture to kind of summarize it. But basically, we wanted to use this ovalbumin antigen injections to stimulate antibody production because we wanted to be able to easily measure something. So the OVA acts as a non-replicating stimulant to the immune system, and it has a measurable response that we can, like I said, measure without causing any major deleterious effect. So what we set up was we had 3 groups of 3-week-old pigs, so 30 animals total, and we had it 50-50 male-female. And they were fed a commercial feed that we got here in Kansas. And we had added we didn't add anything at 0 parts per billion, so whatever was in the normal commercial feed. Then we added 10 parts per billion or 20 parts per billion for the other 2 groups. And this was the aflatoxin B1, like I said. And this was just purchased from Sigma Aldrich. So we took after we mixed it all up, which I'll get into in a second, we had it tested by Dairyland Laboratories and had them give us the exact amount of parts per billion of aflatoxin B1. During the feeding on day 7, the pigs received 1 dose of the ovalbumin so that they could get their immune response stimulated. And like I said, this stimulates the immune response to the aflatoxin B1. And then we were able to measure it using an ELISA kit that you can just purchase to find ovalbumin specific IgG. During the experiment, we took blood samples, pig weights, temperatures on days 0, 7, 14, and 21. This is kind of just the graph of what I just said. We started the project on day 0. And then -5 days to get the pigs adapted to the diet. And on day 0, we started feeding them the aflatoxin. So we had the control, which we didn't add any additional aflatoxin to, and then the one with the 10 parts per billion and the one with 20 parts per billion. At that time, we took their temperature, weight, and blood sample. On day 7, we added the ovalbumin, and we did their weights and blood as well. And on day 21, we ended the experiment. So these are just the different groups. So we had 10 control, mixed 50-50 male-female, and then the other 2 groups with 10 parts per billion and the 20 parts per billion. And we gave the same amount of ovalbumin to each group on day 7, so just 1 mg. So we'll get into the results in a second. So the feed used for the project, we had it measured, like I said, and well, I'll go in order, sorry. So the uncontaminated control, 0 parts per billion, obviously we didn't mix that with anything. So that feed just came straight from the supplier. The 2 experimental doses that we had, we, like I said, added the 10 and the 20 aflatoxin B1, and then we mixed them in a ribbon mixer here at K-State, and then we took samples from 6 different locations. We pooled those samples, sent them to Dairyland Laboratory, and they came back with exactly what we were feeding them. So it turned out that the 0 control diet had no aflatoxin in it, which is good from that, the feed should not have it. So that was good. And the 10 parts per billion, by the time we mixed it and sent it away, it was really 6 parts per billion. And the one that we added, the 20 parts per billion, was really 15 parts per billion. So we were feeding 0, 6, and 15 to the 3 different groups. And these concentrations are below what is allowed by the USDA, which is what we wanted to do. So 20 parts per billion was what we wanted as the max. Why we didn't know what our input or what the initial parts per billion of the 0 was. So we weren't sure if it was going to really be 0 from the company or if it was going to have a little bit, but it was actually 0. So what we found when we did serum, weight, temperature from the 3 different groups over the period of time, we analyzed the serum using the IgG ELISA kit that's specific for the ovalbumin, and that's on day 21. And we found that there were no significant differences found between the 3 different groups. So you can see the control, the 10 parts per billion, and the 20 parts per billion. And like I said, the real numbers were 0, 6, and 15 parts per billion after we got the feed measured. And we also looked a lot at the weight gain, and we compared it to the control group. So again, we have the green as the control, orange is the 10 parts per billion, and 20 parts per billion for the blue. And you can see over time at -5 all the way to day 21, they're almost identical. So there is no significant difference in how much the pigs are gaining on a day or on a weekly basis. So the second experiment was going to look at the immune response to a common vaccine, the swine influenza virus vaccine. So with this one, we have 2 groups. It was set up with 2 groups of 3-week-old pigs, so 20 animals, again, 50-50 male-female. One of the groups was the control, and it was going to be given feed without aflatoxin. And we established from the previous experiment that the place we were purchasing the feed from was really 0 for aflatoxin B. And then the experimental group was going to be given the contaminated 20 parts per billion of the aflatoxin B1. On day 7 of the experiments, they would be inoculated with the Zoetis flu shot for influenza virus. So just a purchased vaccine, and then boosted on day 28. And we were expecting to see potentially reduced vaccine efficacy due to any kind of immune response suppression due to the aflatoxin exposure. We were going to use the SIV ELISA test to determine the immune response between the 2 groups. So this experiment never happened because about 2 days before the pigs were going to be put on a truck to be shipped to us. We had the supplier test for antibodies for swine influenza virus, because obviously if they've already been exposed to swine influenza virus, this experiment would not work. And unfortunately, a high percentage of the animals actually had prior exposure to this virus. And so we told them that we basically couldn't use them because the test wouldn't work. So we had to cancel it, like I said, about 2 days before they were scheduled to be put on a truck for us. So we did find out that, low levels don't seem to have much of an effect. So maybe the 20 parts per billion is, a reasonable amount, and that if lowering it wouldn't help from the first experiment, but we weren't able to finish up the actual, checking the vaccine. But we were able to train quite a lot of graduate students, and they learned new skills working with large animals with BSL-2, giving the shots and taking blood and doing ELISAs on the samples, kind of how to organize an experiment all together. So we had a PhD student that was helping us with the IBCs and the iCooks and helping to organize graduate students. We had a couple masters and a research assistant working on this. So outcomes for the project and impact: the pork industry has a significant economic contributor to Kansas. Our research aimed to determine if there was any kind of hidden detrimental effect to these low level under the 20 parts per billion aflatoxin exposure in feed, and with the idea that even a small decrease in weight gain or loss of efficacy of the vaccine would have a large cumulative cost to the industry. The first experiment showed that, our hypothesis is probably not causing a weight gain problem, but we don't know about the vaccine efficacy. So our final thought is the amount of aflatoxin used in this study is below the USDA allowable limit, for which there is little information, but we showed no significant difference in our results. So it kind of validates, like I said, the normal 20 parts per billion limit. So let's see, the summary and future direction. We were unable to get the swine for the second study. And unfortunately, it was completely unanticipated, beyond our control. So we had to cancel that second study. And the only thing that we would maybe think of if we were to do this again is any kind of large animal or maybe even animal study where you can't have as much control as on the bench. It might be good to have a 2-year funding period so that, if something goes wrong, you could maybe recover and do it again. So that's it for my talk. And if you have any questions, that's great.
Yes, as Dr. Vanlandingham said, if anyone has any questions or wants to know more about this project, you can reach out to her via email.